Hello, everyone, and welcome to Ty and Sky's Health Pub. This is Tyler, or should I say, welcome back. I am joined by my ever so lovely guest, Mr. Skylar. Hello there, Skylar.
Hey, it's been a long time.
Dude, it totally has been a while. We are back for season 2 after a short hiatus. So many things have happened in each one of our lives collectively. So we apologize for leaving the airwaves silent with all of that pubby health pub goodness over the last couple months. We were thinking about you guys. You were with us in our hearts. And we are so happy to be back talking about health topics. We are actually going to be discussing something huge that we have to catch up on that happened while we were on our between-season hiatus. Yeah, no, you should be worried, Skylar. Did you hear, because I don't know how things are in Android world. Because am I right? Are you an Android person, Skylar?
Sometimes I wish I had an Android phone, but I actually do have an iPhone.
So we are both Apple zombies. So,
hey, I'm just saying, I didn't really pick the phone, but it's once you start on an iPhone, it's really hard to want to avoid sticking to the contact list, that you just keep updating over time.
Oh, exactly. Yes, it drags you in, and it keeps you there. But in the biggest health related Apple zombie news for Sky and I to bring to you today, the Apple Watch 4 dropped.
Geez.
Yes. And coming off the very, very successful Apple Watch 3 showing over the past year of 2017, 2018, the Apple Watch 4 added some kind of bigger screen, which is all right. But it added health features, specifically one that we'd like to discuss right now being the ECG or electrocardiogram application of the watch. Actually, this is a feature that is an FDA-cleared feature on the watch that has a user placing their finger against the digital crown and actually can detect normal sinus rhythm or atrial fibrillation. Now, you may ask yourself, what the heck are those things? And why do they matter to me? Well, your heart beats at a rhythm, and this rhythm is carried through or can be measured via an electrical pulse. Now, normal sinus rhythm is that showing us the normal pulse through the heart, and atrial fibrillation is actually where we have like a quivering of a part of the heart called the atrium. And why this is significant is this can actually be a risk factor for people throwing blood clots into other areas of their body, like their brain, and having a stroke. So the idea being that if we can detect atrial fibrillation, we could potentially prevent strokes that may happen by alerting people to the fact that they're having atrial fibrillation and could be at risk, so they could get in to talk to their healthcare provider.
So really, this is actually becoming like Star Trek day by day, right? So the future is now, right? Where soon we're just going to have actual vitals where, I'm going to look down at my Apple Watch and then, I'm going to have a color indicator for how well my health is doing, and it's going to go red as soon as there's a major issue.
Yeah. And can we say, I would hope that the color of health would be purple. Isn't purple just a wonderful color?
Purple is the color of royalty, though, Ty. So we gotta be careful there.
That's true. Well, okay. What color of health would you pick?
Well, let's think about traffic lights, for example, right? Green means go, right? You're good to go. Yellow means you might want to have a little bit of a warning. You need to slow it down, pal. Or then red means you need to stop.
Yeah, that's a good point. I think your colors went out over mine, Sky.
But purple could be even the higher rank of green for people that are in pristine health.
People who are royally healthy can score a purple.
That's what we should aspire to be. We all should be purple.
But yeah, so this is super interesting because this is actually, if we think about this, Skylar, the first FDA approved over the counter ECG.
That's huge. Actually.
Yeah,
that's a really big deal.
No, yeah.
They've had experimental stuff for years about this, and always trying to constantly push the boundaries of what we can do, especially for the watch itself. Like the Apple Watch when it first came out was a huge deal because
It
people
was.
were like, "Oh gosh, this could be like everything. I can get my emails on this thing. I can answer phone calls. I can I can use it as a Fitbit. Like there's
Yeah.
all sorts of stuff that I could do." And now like they are adding this new health feature that is just it's mind blowing. Like where suddenly the greater implication that I see is that Apple Watches are going to become something that gets purchased by hospitals for telemedicine or for outpatient therapy, even to check up on folks.
Yeah, and I mean, do you think we'll see a time when potentially insurance companies might offer benefits for people to like kickbacks on a plan that would encourage people to purchase something like an Apple Watch?
I think
Do you
that
think
there
we'd
is the
ever see that?
likelihood that could happen, and then also because with the current cost of I don't know how much what is the price of the Apple Watch 4 currently?
So that is a wonderful question, and if I consult,
We got to do a Google search.
consult Dr. Google.
Hey, I would ask Jeeves, but that's not a thing anymore, so I can't ask Jeeves.
When did that go down? That was seriously my middle school jam. Was asking
Ask
Jeeves every
became
single question.
ask.com, and then
Yeah, they dropped Jeeves. Jeeves got fired. Dr. Google says that the cheapest way we can get in the game is for $3.99 and 0 cents.
hey, I imagine that there could be, insurance could possibly did not. I mean, we see like the same issue with like other stuff in healthcare where, insurance could, elect to cover certain or a percentage of the cost of it, because especially if they're looking at it as a health device, period, or a medical device, excuse me. So if they look at it as a medical monitoring device as opposed to just this is my phone that is also my watch that is also my email device, I think it's really how we classify it, and then that will determine whether or not insurance companies will either pick up some of the cost associated with implementing it into their hospital and their care systems. Other than that, though, I do think it's still like a very viable purchase for a lot of people. I mean, it's still pricey, though. Don't get me wrong, but I think that any sort of the potential of like things that could happen just because of implementation, like grants coming up to help people buy, Apple 4 watches, like that would be crazy. But it is something that could happen, especially if it becomes the future of monitoring at home.
Yeah, and I think it's very interesting in that if we talk about like things like Fitbit is something you brought up, and the Apple Watch has a Fitbit component. It kind of places users more in control of their health data that way. Speaking particularly of Fitbit or the fitness workout section use of the Apple Watch, it really places people in control of their fitness life. And I think that this is a step towards placing people more in control of their medical life. Just offering you yet another piece of data that can be monitored and used preventatively, like we talked about, where it could raise or it could alert you when the watch detects an abnormal heart rhythm and let you know that it might be the time to go in and see a doctor and figure out what can be done. If anything needs to be done about this potential irregular heart rhythm that the watch sensed.
Definitely. And even just as basic as an alert as you might need to sit down or you may need to take a step back from whatever you're doing and take it easy because you're, stressing your body for whatever, purpose that you're engaging in. It's definitely I'm excited to see where the field goes with it because, I imagine that there'll be other people, other companies, that jump on the prospect of, incorporating something like that, kind of like the Apple Watch, to try to encourage people to use it at home, like as a constant tracking. But, I think the Apple Watch makes perfect sense because a lot of people have iPhones. It's complementary to what's already being used by the patient.
Yeah.
So it makes it really easy to engage upon in that activity and really monitor.
Yeah, exactly. And at this point in the podcast, all of our listeners out there might be like, look at these two Apple zombies just drinking the Kool-Aid. Both Skylar and I are drinking the Apple Kool-Aid, the Tim Cook Kool-Aid, cherry flavored. However, I think it's important for us to discuss too that this may not all be rainbows and kittens and smiling narwhals. It's important for us to discuss that there's potentially another side of this issue too. I mean, it's kind of the issue that comes about of because we have this. Is it such a good thing to have everybody have the ability to get an ECG over the counter? We've talked about some of the benefits of that. The fact that it can alert somebody who may not know that they're having this irregular rhythm called AFib that could potentially increase the risk of them having a stroke. However, the U.S. Preventative Task Force, which is kind of a task force of scientists and other kind of people in the know that come together to look at all of the available evidence in medicine and come up with recommendations that are rated on a letter scale. Actually, after reviewing data on electrocardiograms and electrocardiogram screening in adults that have a low risk for a cardiovascular disease, they actually came out against that. So the U.S. Preventative Task Force, or USPSTF, recommends...
That's a long one.
Yes. Recommends against ECG screening for adults who have a low risk of cardiovascular disease. Now, you may be sitting out there wondering, how could anybody represent, or how could any task force come out against such a wonderful thing? You sitting out there drinking the Kool-Aid as well. Well, the reason that they come out against this is they're worried about any false positives.
Oh, yeah.
So this is something that's important for us to dig into because false positives carry with them risks. I mean, there's the risk of anxiety starting out. If you are in fear of your heart rhythm potentially being irregular when maybe at that point, maybe it was something wrong with the way the watch detected it. It wasn't actually atrial fibrillation that you were in, or maybe it was something quick that passed by real quick, and it doesn't really necessarily mean once you kind of follow this down and get into your doctor's office that it's anything that increased your risk for a stroke. Or like I mentioned before, it's the watch detecting AFib when there is not AFib present. This could lead to needless doctor's visits for you, and needless costs, and kind of at the other end, potentially needless interventions. So the USPSTF comes out against recommending all adults to be screened based on kind of these factors. I mean, what do you think about that?
You know, I think that's a valid concern because, you know, my first thought was, you know, what if a kid has one and they just jump to the full, you know, like if they, like something happens or there's some like kind of type of irregular thing that occurs, you know, especially technology is not 100% perfect, you know.
It's not.
And some type of alert being sent out that mobilizes the system will accrue costs not just on the patient themselves, but on the hospitals. And so I do think there is a concern about, especially, you know, say if an ambulance gets involved. You know, ambulances are currently, you know, infamous for being, you know, stupid expensive to, you know, even get as a patient. And many people will, you know, elect to not take an ambulance if they have the decision to. Even with insurance. So I see it as, you know, situations where you might not have called an ambulance or, you know, 911 period, that, you know, these type of situations could trigger that system, and that's going to be a major cost on both the patient and the system, which,
Yeah.
is already kind of a burden in terms of what we've been working with. A lot of our issues with the current healthcare system. That's why there's been so much talk about, alternative methods, or how do we improve the system? How do we, save money and, ensure that we're providing the best services we can, but also making it affordable for everyone to the best of our ability. And it's a lot of tough questions, and we could go on about that forever. Like
We could.
But as far as this though, I definitely can see why they would say no, because it could the greater implication could be that it has a negative effect rather than a positive. And that even though there could be, the anecdotal evidence of, people's lives being saved because of it, but we really have to define that, cost-benefit analysis there, which, a lot of people would argue that, just saving one life means that it was worth it to do so.
Yeah.
But, when we are potentially taking money or utilizing funds that could have gone to other patients, and that there are issues in that line, then it's really a question of, are we doing the right thing at all?
Yeah, or potentially leading to medicine therapies or medical therapies in the form of medicine or procedures that may not have had to been done otherwise if the person was not made aware of this atrial fibrillation, that may not have been needed but were done because of this, and could potentially carry harm in just taking the medicine or doing the procedure, because no procedures and no medicine that you can take is without any side effects or adverse effects or risks in and of itself.
Right. And to the opposite point as well, though, I do think that it does have benefit, even triggering a false alarm, in that it could encourage people to actually go to the doctor.
Yeah.
And, in a lot of cases, some people just will not go, and they could have insurance, and they just decide, oh, well, I'm not going to, I'll be okay. But they could go in for a routine checkup, and it could encourage them to do so, even if it was like an error, just to make sure that things are okay, that things are. So I see that there is definitely a health benefit there.
Yeah.
So I think it's really just the key, the crux of the issue comes down to cost versus care, and what is more optimal in this situation.
Yeah. So at this point, we'll leave the question up to you guys. Hit us up on our Facebook page. Let us know what you think. Are you in favor? I mean, the watch is out, so there's no putting it back in the box to say. But what do you feel? Do you think it's a good thing that ultimately a good thing that everybody potentially can have access to getting an ECG whenever they want, right on their wrist? Or do you think, like we talked about, that it may not necessarily be the best of things?
Or do
Reach
you
out
think
to us.
everyone should have an Android phone and we should not have Apple products at all? Please let us know.
And you unsubscribe
offer us
from our
any alternatives
podcast.
that Android is working on for this. We'd be interested in hearing about those as well, to see if there's any other alternatives besides what the Apple Watch 4 is doing.
Yeah.
Because especially maybe they have a different way of doing things, or, we're all about tech here at Titan Skies Health Pub and how it intersects with our healthcare system.
Exactly. So let us know. And kind of on that topic, on our next episode, we will be discussing the Apple Watch Part 2. Help, I've fallen and I can't get up.
Oh, no. Oh, it's just like that great commercial.
Oh, so stick around our channel for that as well. It has been wonderful, guys. I cannot tell you how happy I am to be back speaking with Skylar and back on the interweb waves.
We're back on the interweb waves.
So y'all have a great time. As usual, Skylar, I think we should end it with our toast, if we can still remember it from months ago. So raise your glass high.
Glass.
I got mine as well. My copper. Ready? 3, 2, 1. To knowledge, good and true.
True.
To the future health of youth and the prosperity,
that
they bring.
I swear I have
got
it
some
written down
homework to do.
somewhere. I do. No, it's a good one. But yeah, it's definitely great to be back, and we look forward to bringing you guys some more, health knowledge, because knowledge is power, right?
Right. That's, yeah. I Skylar, you stole the words out of my mouth.
Well, I'll make sure to, if I buy you an Apple Watch here soon enough, I'll make sure that it's all purple and everything for you. So,
Oh, that'd be so wonderful. Well, we'll catch you guys on the flip side.
all right, have a good one.